Thank you for listening to the Bladder Battle Podcast special series, I See in the Dark. This is going to dive deep into the perplexing disease, interstitial cystitis. This podcast is intended to bring awareness and create conversation around the illness by providing possible remedies, tips for managing the disease, how you can show support, and so much more. This podcast is not intended to be a medical alternative for physician care, nor to treat, cure, or prevent any illness or disease. Always consult with your physician for professional medical advice. Today, we are talking all about pelvic health and therapy for interstitial cystitis with Julie Blacker. Julie, thank you so much for being on the show today.
Well, thank you so much for having me. I'm so excited to be here, and thank you.
Absolutely. So before we really get into it, why don't you tell our audience what you do for a living and what your official title is?
I have two jobs. I am a pelvic floor therapist, and I work in an outpatient pelvic floor physical therapy clinic. Well, it's actually just an outpatient physical therapy clinic, and I am the pelvic floor therapist there. But I am also working in medical device sales at a pelvic floor device company. So it's really amazing because I get to try out and use all of the fun therapies and devices that I would bring into my sessions. So it's really just an amazing opportunity to be able to do both.
Yeah, and it goes hand in hand.
Yes,
So that's awesome. And so really gives you that, firsthand experience.
Exactly.
So I kind of want to get into your personal story with pelvic pain and kind of how that led you into getting involved in pelvic floor therapy.
Yeah, well, I think some of the best pelvic floor therapists have gone into it just because they themselves have pain. And so I learned from the best. And I had a lot of pain while being pregnant, pelvic pain and such, especially surrounding my sacroiliac joint and just in general. So after having my first kid, I didn't, really know how to do things, how to push. I wasn't really taught. Pelvic floor was not a buzzword. And I'm not talking about the dark ages. It was about 8 years ago that I had my first kid, and, pelvic floor was starting to come into light, but not like it is now. So when after I had him, I, would see when I started exercising all this doming of my stomach, and I just wasn't sure what that was. So I thought I had to do more sit-ups and crunches and, come to find out it's diastasis recti. And I got pregnant with the second kid when my first was 7.5 months old. So I never actually healed my diastasis from the first kid, got pregnant with the second, and he was a large baby. There was shoulder dystocia, lots of birth trauma, if you will. And then once he was born, I just was completely torn. The connective tissue was just torn apart. I could stick my fingers all the way down. I had a hernia, so I knew I was going to eventually need surgery. And then I had a third kid, got pregnant with a third. And through this whole time, my husband and I joke that I literally went the entire second Obama administration without getting a period, because I was either pregnant or breastfeeding. And, after the third, I was a mess. I couldn't bend forward. I couldn't stand up straight. I couldn't lift things. I couldn't carry anything. My sacroiliac joint was a mess. And then, that has just been my own journey. And I was really thankful that I fell into pelvic floor therapy after I had my second kid and just started learning some of the techniques for breathing and pain management, and became a patient myself in order to help manage it. And I think that it just kept, really furthering my need to learn more and my love of pelvic floor therapy. And I just am so passionate about trying to help people, that, just to avoid pain and try to bring it home, or not bring the pain home, but try to bring what you've learned in the session into the home so you can really be free and not, maybe not have to be the patient that comes in weekly, every week for the rest of your life, and just, maybe a check-in here and there, but you can learn how to manage things and live your life.
Right. And right now, what I feel like is those of us, with any chronic illness, but especially with IC, you kind of have to become your own advocate, and your doctor may not suggest pelvic floor therapy. It just may not come up. So this is definitely something that, I want to open everyone's eyes to, and maybe, bring it up to your doctor. Maybe this could be right for you. I'm not saying it is, but, it could definitely give you relief and really help with some of those chronic symptoms.
Yeah.
I kind of want to get into becoming an occupational therapist and kind of what was involved in all of that, like how much schooling, just a little bit of background on that.
Yeah. So this was a career change for me. I was previously a teacher and worked with young kids, and figured I was going to go back. Instead of getting a degree in special education, I would, get my degree in occupational therapy and work with kids. And of course that, you plan and everybody laughs because it just doesn't work out that way. And I wound up, after being in a variety of different settings, just kind of falling in love with the rehab side of it and helping people. And then, so occupational therapy school, you have to do a whole bunch of prereqs. The prereqs are anatomy and physiology, statistics, psychology. So occupational therapy is a lot of psychology-based treatments, in the sense that you're really getting to understand anything that might be going on mentally, and just how the brain can affect the rest of the body. So, sort of like a psychosocial development. So, we say psychosocial development, and it's like using the body and how the body works with the mind and all together. And it really does. There's so many amazing and powerful studies about how a mindset can affect your health in general, and just, how stress, for example, can cause, even with the IC, just cause flares, and so many other diseases can just have flares and be brought on just by stress alone. So it's learning to manage the connection with that. So occupational therapists definitely focus on the cognitive aspects of things in addition to the physical aspect. But so it's a lot of, learning about the body and the physical body, like the anatomy and physiology and physical disabilities. And in addition to that, it's learning about mental health, because that is equally important to occupational therapists. So that's a 2-year variant, or at least my program. Every program is different, but my program was very intense. It was on a medical school campus, so very science based, and they took it very seriously. It was literally the hardest time of my life because OT school is so intense. So I love it. You take the boards, you really have to prove that you are able to do everything. So when you go to an OT, they're completely licensed. And in addition to it, they are, I know there's always this question, can OTs do internal treatments? Yes, we can. We can do them just like a physical therapist, because we have all this training and many years of schooling. So the pelvic health specialty, though, and that's the thing, it's like a PT, like an OT, it doesn't matter. You have to have this advanced training in order to be able to be in a pelvic floor therapy if you're going to be doing internal.
I think that's really great. You have both the, cognitive side of it and the physical side of it. Yeah. And, stress plays into a lot of these chronic pain and chronic illnesses. So it's something that I think when you just go for a doctor's visit, and especially just with a urologist, sort of that mental aspect definitely gets forgotten about.
100%.
They forget to tell us how to manage our stress, not that it's their job.
Yeah.
It just doesn't really get discussed as much as, I would like to see it. So this kind of is like an all-in-one package deal. So I think that's great.
No, I 100% agree. And I think it's really hard because you go to these doctor's appointments and if you're lucky, you get 10 minutes of FaceTime with the doctor. It's just because of insurances and things like that, you're not getting that, real connection with the doctors. So then you come to therapy and here you are. I mean, a session, I've heard of some places being 30-minute sessions, but I'm supposed to treat for 45, but I actually treat for an hour. So here I am one-on-one with a person for a whole hour. And we are focused just on fixing their chronic pelvic pain or their pelvic floor dysfunction. So I get a lot more time and I can give a lot more information and do that deep dive into all aspects of a person's situation. So we can fix the mind, the body, the breathing, the positioning, the bladder, everything.
Yeah. I'd like to kind of get into how pelvic floor therapy can be beneficial for someone with interstitial cystitis. And many of those who have IC also might have pelvic floor dysfunction. They might have SI joint dysfunction. So this is where this type of therapy can be really beneficial. But before there even is an understanding that they might have these other relatable conditions, how can this just be great for helping to sort of relieve those pain points and those symptoms within the bladder and just really the whole pelvic area?
Yeah. So when you go to a pelvic floor therapist, you go through the evaluation and you're making sure that you're understanding the situation, but keep in mind it's your body and you are in complete control the entire time. I mean, if you do not want to do an internal examination or you do not want internal treatments, that's fine because it's your body, like I said, and there's enough to do without it. However, as I always say to my patients, you don't have to, but during an examination, it just gives me more information. But two, sometimes with an internal treatment, I can really get in there and work to release the muscles that are so tight. I've seen a lot of that with my IC patients, that their muscles are just so tight, like you're saying, and the chronic pain that goes on. So we do a lot of just I'm saying release the tissues because sometimes you do feel like a release of you'll feel pulsing and heat and tightening, and then all of a sudden everything lets go. So that's why it'll say like a tender point release. But even just stretching the muscles and getting them to relax, because many times they're so hypertonic, meaning that they are so tight and so on all the time, because when you get into this pain response, that's what happens to your body. You just are clenched, you're constantly contracted. So it gets really hard. And a lot of the symptoms with IC can be alleviated just by these internal treatments. But that being said, I mean, I think that some of the best places to start even are just the breathing and looking to work on down training your nervous system. So meaning that you're working, since your body is already in a fight or flight mode because of this pain, you're working on calming and relaxing and teaching your pelvic floor to relax and just move naturally. Because what happens is your pelvic floor almost stops moving because you're just clenched into one spot. So we have to get it to move naturally. And so just by starting with the breathing alone, that will help. And then in addition to it, we work on the posture. Because, for example, if your hips are tilted forward, so they will call that an anterior pelvic tilt, where it sort of looks like your back is arched and you're leaning forward almost. So this anterior pelvic tilt could put a lot of pressure onto somebody's bladder. So it's getting you to go into a neutral position.
Okay, so kind of like Pilates.
Yeah, exactly. Pelvic neutral. I love when people come in with Pilates background or yoga background, because then they just have an understanding of breathing. And then, we work to make sure that with the breaths that their lower ribs are expanding with the breathing to help with that. Because what happens if you're getting that big breath and everything is moving, then your pelvic floor will naturally start moving. We say these pelvic breaths. So on the inhale, the pelvic floor drops down, and on the exhale, the pelvic floor comes up. And so on the inhale, the belly is big and you're expanding your belly. And I think, as people, we're always sucking in our stomach because we don't want to seem like, we're out of control in a way. So now it's all about, all right, it's cool. Let it out, belly big.
Yeah.
So
definitely.
It's just like a lot of retraining and learning how to do things differently, because your whole life you do it one way. And then we have to go back, you've learned all these bad habits, and then we have to go back to how they are done the other way, and how they should be done, I should say.
It's pretty amazing too, because when you even say, for someone who hasn't done pelvic therapy, but maybe has tried Pilates, when you try these positions or you try to put your pelvic in neutral, it feels weird at first. You're like, this doesn't feel right.
Oh yeah.
But once your body finally gets used to that, it feels so right.
Oh, yeah.
It feels like a long lost, comforting feeling. You're like, oh, that's where I'm supposed to have that. It's just,
yes.
It's very interesting. And I've done a lot of, different types of fitness classes since I got my diagnosis with IC. And another one that I tried was bar, and just lifting my leg up a couple inches off the floor and pointing my toe, and just the way my leg lifted, it was in the right position. It felt good. I don't know. It was euphoric.
Oh yeah.
So it's just these small little movements and just finding where we're supposed to be, because like you said, our posture, the way we sit at work. I mean, there's so many things that can really contribute to all of the pain that we're feeling, and our back has a lot to do with our bladder. And,
yep.
We kind of hold all the stress in this pelvic area, unfortunately.
No, so it's true. I mean, there are spinal nerves that come off of your spine and they go to your bladder. And so if you are just in a not great position and you're rounding your back and you're slumping, it's, that also will affect the back, the bladder. And so exactly like you're saying, I mean, just teaching people, you have your sit bones, they call it the ischial tuberosities, but you can call them the sit bones, and you should be sitting on them. And I remember learning that and thinking, wow, they're called sit bones, and I never thought to actually sit on them.
Right.
So, but like you're saying, it's really hard at first, but then all of a sudden it becomes the new normal. And then the other way feels strange. So
right.
It's learning how to redo things and do them not perfectly, but just learning how to feel where your neutral is, so you can get back into, that good alignment. And sometimes I swear to you, the biggest thing with my Pilates patients, I have to remind them, okay, you're always contracting. Now you have to relax, relax. And so, yeah, but I mean, so much of this goes on with IC, and there's so many great places to start. And I think that people hear this diagnosis and get so scared, but, and I have people that walk in the door and they're like, just completely nervous about therapy. But I always tell them therapy is non-invasive. The worst that quote unquote, worst that happens is there's an internal assessment, if you will, and I can do treatments. But when people leave after they've had it and it actually feels better, suddenly they're not scared anymore and they see the value of it. And, I always say to people, I mean, any treatment, if you're having a 6 out of 10 or higher of pain, then stop, because that shouldn't be the case. But, so much can happen in therapy that, I mean, my patients, when they come, they love it because it's their time. I do cupping, we do massages, these manual techniques. We roll, getting their abdomen. So I do a lot of myofascial work, meaning just like working at the layer of the skin, even and just below of their abdomen, just trying to get everything to relax surrounding their bladder, because that's what triggers so much of the pain. And then not only that, but just trying to like I said, calming their nervous system. That's a huge thing for them.
Right. Because we're always in, fight constantly. So when you're stressed out, it brings out all of those autoimmune conditions. And although IC isn't officially considered an autoimmune disease because you can't test for it with a blood test, it does definitely act like a autoimmune disease for sure. So I kind of want to get into your, other endeavor that you're into, which are devices. Tell me a little bit about the company that you work for and kind of how you got involved in that.
Yeah, so I work for Current Medical Technologies, also known as CMT. It is a pelvic floor device company, and I love every day what I do. I get to work with all these fun, dilators, biofeedback, stim units, wands, lubes, and creams, and just anything that you can think of related to the pelvic floor. I get to play with it on a daily basis, and it's really fun. My friends love to now, whenever we try to get together via Zoom these days, it always comes into, tell me how I should move my pelvic floor. What should I do? So it's really fun. But, I got into this job because I thought, being a clinician and actually working with the products, who better to sell them, if you will, than that. But I'm also their clinical director. So I answer all their clinical questions, and I am responsible for bringing new products onto the line. So I do a lot of research. I make sure it's all evidence-based, because I don't want to stick anything out there that could potentially be harmful.
Right.
So, and I always say to people, well, first make sure that you consult with your trained medical professional before embarking upon anything. But when you do, I'm happy to work with you as to how to use them and such. So, I've had a lot of my IC patients where, they've come for treatment with me, and then and prior to even working with CMT, I used to recommend that they use these wands that they could use to just get to those tender spots in between sessions. Because let's face it, they're not coming to therapy, every day for several hours a day kind of thing. Or, some of them don't even get to come weekly, depending on their insurance. So it's my job to teach them how they can manage this at home. So that was one of the things that I had already been working with some of their devices. And that's one of the things that I found so exciting about being able to work on the side that I work on now, is that I can speak to how effective they are, and how much they can really change a person's outcome. Because if you can teach somebody to manage their pain in between the sessions and what they can do to manage a flare, you're giving them this autonomy that really helps with somebody's long-term treatment and, the maintenance of this disease, if you will.
Absolutely. And I'm very excited. You sent me one. So it honestly made me happy. I was like, oh, finally, I can do something at home, because I'm still, I'm trying to figure out therapy. And I don't know, it's kind of hard to describe, through a podcast, but how do you use one? How does it work?
Yeah. So, and again, make sure that, before even considering using this, you've spoken to your trained medical professional, whether it's your doctor, your therapist, the nurse that you're working with, anybody who can really speak to it. But so the first thing I recommend is to lay, semi-reclined. So maybe propped up with some pillows. I've actually told some people, get into a bathtub with some pillows behind you, make sure you're Legs are spread apart but relaxed. So, I tell them stick pillows under your legs, anything that can just make sure that you are in a totally relaxed position. Make sure there's a lot of lube involved. Sometimes I say like the Desert Harvest Jelly is a really great one for anybody with IC, or there's the Yes line, just anything that could be really calming and just something that's not going to have any parabens and just any truly harmful ingredients. That's what you want to stay away from. And make sure there's lots of lube. And so just start at the entrance of the vagina and actually I should say this, that before you even start, I want you to envision the opening of the vagina to be like a clock. So 12 o'clock would be facing up towards the pubic bone. 6 o'clock would be facing towards the anal sphincter and the perineum. And then you have 9 o'clock and 3 o'clock directly across on the sides. So when you are doing this, the first thing to know is that 12 o'clock is actually where your urethra is, which is your connection. The urethra is frequently a cause of pain with IC. So you definitely want to stay away from that. So I kind of tell people, stay away from from between 11 and 1 o'clock on the pelvic clock. So kind of avoid 11, 12, 1. And then you can start at 2 and just gently go down. But I actually say also stay away from directly at 6 o'clock, because from there, towards the back is the coccyx. Oh, yeah. So when you exactly your tailbone, so the coccyx. So when you're really far back, make sure you are avoiding this 6 o'clock. And just so you know, sometimes too, the 6 o'clock, if you're just at the opening of the vagina, that's where your perineum is. And some people have tearing from childbirth, or that it could be a really sensitive spot. So just note that could be a sensitive spot as you're going through, but you're going to sort of slowly go in a clockwise and counterclockwise manner from 2 to 10 o'clock. And then, go back. And you can go in slowly and hit the specific spots that are really painful and tender. And when you're doing this, you are adding very little pressure. You do not need to press down and dig in, because that's going to be causing a lot more pain. These muscles are super thin, and the tissues, so you don't need deep pressure in order to affect them. But when you are working with a pelvic floor therapist, they will really work to make sure that you are comfortable using it appropriately and applying the direct amount of pressure. So that's why I always say it's best to work with somebody who knows this, so you can make sure that you're using it appropriately, applying the correct amount of pressure.
How long should you hold it at each position? Like about 30 seconds, or do you pulse it at all? Or
so actually I tell people press down very slightly once you're at your tender spot, press down very slightly and hold it. And you hold it for up to 60 to 90 seconds, actually.
Oh, okay.
You might feel pulsing. It might start getting hot. It might pulse faster. And then all of a sudden it'll just sort of let go. That's why they say it's a release, because it almost feels like you are releasing that spot. And then apply a gentle stretch at the end. And that will be a great way to just start relaxing the muscles and getting them to open up and elongate to allow for it. The problem is that when you have this pain, it's hard to go to the bathroom. It's hard to have sex. It's hard to just engage in so many daily activities. And so it's important to open everything up.
Right. Because the goal here is to hopefully restore our lives to some sort of normalcy.
Exactly.
It's very frustrating. It can be just really stressful and can put a strain on your relationship when it comes to, having to avoid sex because it's painful. Even when it comes to exercise, riding a bike, anything. And then of course just going to the bathroom, like it's almost like you're afraid of it. And
oh yeah,
it should be relieving. It's something we have to do. These are really great tips for, trying to manage some of that pain and get some of that relief. Are there any other devices that you would say could potentially help those with IC that maybe they could bring up to their practitioner?
Yeah, so it's funny. Sometimes some people will say, some therapists will recommend stim, using it externally, because when you're using stim, it's sort of like a TENS unit that it just can calm some of that tension and some of that pain. There are dilators which can work. Some therapists have recommended that for just being able to give a gentle stretch. Some people say use them rectally, to use the wands more rectally, to use the dilators and such, just trying to give those gentle stretches. And it's also just positioning too. So teaching them how to use these devices and using them in different positions. But I think that the wands are a great first line of defense for the home treatments, just because you can actively use them. So we actually got in this new brand of dilators, these wearable dilators, if you will, called the Sheology. But one of the reasons that I love them is because they kind of have a little bit of a curve to them. So to me, it almost seems like you can use them as a gentle way, similar to a wand, but you can use them, and sort of point them there with, while you're actually inserting the dilator and just keeping it there, but holding it to that one spot. But then again, you might get somebody else who says dilators are not the greatest, and to more so use just the wand. So I think it's what works for each person and what they have found, because at the end of the day, somebody with IC, somebody with IC, every case is different. And well, there's many similarities,
right.
You need to treat them as individuals and recommend and just recognize that this is really just a super debilitating disease and you're learning how to best manage it, and whatever works best for each person is what you're going to go with.
Right. Everyone's symptoms are so different. So of course,
100%.
These are, these podcasts are, meant to, start conversation around the illness. The goal is that it just opens your eyes to possible treatments and certain things that you can be doing to help manage your pain, because if you don't know, you don't know. So
exactly. And what you're doing, you said you're doing like the yoga, and happy baby pose, such a great one where you're laying on your back and you're bringing your legs up and you're reaching in
so much.
Yeah, it's such a great one for stretching your pelvic floor, or child's pose, just really getting into those deep stretch of the pelvic floor.
Yes.
So
yeah, before I do any sort of workout, I always go into child's pose and I sort of rock back and to each side so I can really stretch it out. And it just, I don't know, it's so relieving. It's just such a simple thing.
Yeah. No, I get it. And look, there are some amazing pelvic floor therapists out there who are on Instagram or Facebook or YouTube, and they do these talks and they can give really great advice too of some gentle stretches that you can do and such. So Amy Stein has a whole thing about stretches and such, and she uses a roller to do it. So, just everybody has found different ways to help somebody. And I think it's important to just experiment with what works for you.
Absolutely. Well, I really appreciate you being on the show with me today to, share your information about pelvic floor therapy and, of course, all the devices out there that could potentially be really beneficial to those with IC. So, Julie, thank you so much for stopping in on the show today.
Well, thank you so much for having me and letting me share my love of pelvic floor and devices.
Absolutely. And and I want to thank my audience for taking the time to listen to the Bladder Battle Podcast special series, I See in the Dark. Stay tuned for the next episode featuring the CEO of Desert Harvest, which we just mentioned.
Yay!
So stay tuned for that. And I will catch you all next time right here on the Bladder Battle Podcast.